Hello and welcome. In this initial presentation, I will introduce our new FGP members to their benefit options. As there is a lot of important information to share with you, this presentation has been broken down into segments. Each segment provides information about a different benefit topic. For example, you may view other presentations for medical insurance, dental and vision, life, and our other benefit options. In this initial presentation, we will discuss your benefit eligibility, the insurances that we offer, the enrollment window, and the waiting period. So please stay tuned. Once again, welcome to UAMS. We offer an excellent employee benefits package. Insurance and Section 125 Flex benefits are covered in this presentation. Retirement benefits are covered in a separate presentation. You're probably asking yourself, am I eligible for benefits? Well, yes, you are, if your UAMS appointment is 50% or greater, and the term of your appointment is not temporary. Temporary is generally defined as less than 6 months. This is important. College of Medicine faculty must be awarded FGP benefit status by the Dean or Chancellor in order to receive FGP benefits. This information must be keyed into SAP. We offer both core and optional benefits. Core are benefits that every FGP member should consider. It's your basic coverage. UAMS pays the premiums for the following: medical, dental, basic life, basic short-term disability, FGP basic long-term disability, FGP expanded long-term disability, and optional personal liability. Under our optional insurance options, this is additional coverage that you should consider. You pay the premiums but enjoy the group rates. So for example, under optional, we offer vision, buy-up optional life, buy-up optional short-term disability, dependent life, accidental death and dismemberment, and voluntary insurances. We also offer core and optional insurances for our medical residents. Under core, we offer basic coverage for every medical resident half staff member. This is the coverage that you all should consider. UAMS pays all or a portion of the premiums for the following: medical, dental, basic life, separate long-term disability is also available through James D. Foss. Under our optional, this is additional coverage that you should consider. You pay the premium but enjoy group rates for vision, buy-up, optional life, dependent life, accidental death and dismemberment, and various voluntary insurances. In your benefits package, which you can find online, you'll find your benefits summary. This is a brief guide to the benefits offered to all UAMS employees. There are additional benefit summaries available for FGP members and house staff. Please review both for descriptions of your benefits. There's a detailed summary plan description, an SPD, for each group benefit plan that are posted on our website so you can access them at any time. Please help UAMS in its green initiative by accessing SPDs online. You can also visit our office to view the SPD or ask your department to help you. The rate sheet. Please note that if you work 50 through 74% of the time, your rates are different. There is an enrollment window. You have up to 1 month, that is up to 31 days from your first day in a benefits eligible position. The 31-day clock starts the date you first come into your benefits eligible position. If you're not sure when you first became benefits eligible, please check with your department. And during this time, you may enroll in any of the group benefits plans. No health screenings are required. Restrictions may apply to voluntary plans. More details on that will come later. Mark the 1-month date on your calendar so you don't miss the deadline. There is a waiting period for your coverage to take effect, and it's based on the date that you sign up and within your 1-month window. And therefore, your coverage will start on the first day of the next month. Please note the exception for medical residents. Your coverage will begin the first day of your training program, so please enroll in advance. This slide provides you with some examples of effective dates. For example, change the month or pretend this is January. Examples 3 and 4 are for those who actually begin on the first of a month. The waiting period. It takes about 3 weeks to process enrollment, activate your coverage, and for vendors to mail insurance cards. Coverage may begin before you get your insurance cards, especially if you enroll late in the month. If you access your benefits before you get your cards, you may have to pay out of pocket, unless your provider can delay filing the claim. However, you can file a manual claim after the fact to be reimbursed what insurance would have paid. Claims forms are available on our website. Please only contact us for your ID number or to check on your coverage status if it's an emergency. We send a lot of forms to the vendors and they will process them as quickly as they can. But we do understand when a need arises for coverage to be activated as soon as possible. Please make sure that your benefits are in effect before you see a doctor or dentist or fill a prescription. You pay your premium after the fact, meaning the deduction from your paycheck will be for past coverage. For example, the deduction from the January 31st paycheck is to pay for January 1st through 31st coverage. Always look at your pay stub in Employee Self-Service every month. Whom can I cover? You must sign a dependent verification form if you intend to cover any of your dependents. Please refer to this slide for more information on those you may cover and those you may not. Heads up everyone, you will receive 2 letters from WageWorks. WageWorks is our benefit vendor who handles COBRA and HIPAA notifications. Neither letter requires any action on your part. The HIPAA notice advises of your 1-month period to elect benefits. The COBRA notice advises of the option to temporarily continue certain benefits should you leave UAMS or otherwise become ineligible for benefits in the future. Don't panic when you receive these letters. It's just something that the government makes us do. You should be more concerned if you don't receive these letters, as that it means that we do not have a good address for you on file. This now concludes the introduction to your benefits presentations. In the following segments, you'll have the opportunity to review your benefit options such as medical, dental and vision, disability, life, and other benefit options.